Put my AirPods in now that I'm done munching on chips. Okay. So we are live. Now let me go ahead and get shared. All right. If you are joining us, go ahead and drop a comment. Let us know where you're watching from. We love seeing how far-reaching these Facebook Lives can be. One more. Okay. All right, welcome everybody. Welcome to this month's TBI Talk. Let me make sure I connected my AirPods. I did not. Give me 1 second. There we go. You hear me, Perry?
Yep, I can hear you.
All right. So welcome everyone to this month's TBI Talk with Dr. Perry Maynard from Integrated Brain Centers in Denver, Colorado. And today we're going to talk about how blood flow can be affected after a brain injury. I think this is a really great topic, something that a lot of people aren't even aware of, and doctors don't necessarily know to investigate this. So I think it's a really great topic. And so let's jump in, Perry. Where would you like to start? Maybe let's what is blood flow? Like, what does that even mean?
Yeah, no, that's a great question. When we're talking about blood flow after a brain injury, maybe how it relates to neurological health, I think first we have to understand how does the brain regulate blood flow to itself? What is the purpose of blood flow? I guess let's just start on the basis of why do we even need blood, right? So if we're thinking of blood flow, right, why that's so important is it is bringing nutrients, right? So it's bringing oxygen, it's bringing glucose, it's bringing fats, it's bringing amino acids, right? So in essence, the more blood flow you can get to a tissue, the more you can carry nutrients, right? This is why really blood flow anywhere is really important. If you look at diabetics and they have poor blood flow to their feet, right? What happens? Their feet and the nerves start to die. And if it's bad enough, right, their leg has to get amputated. And if we look at a lack of blood flow to the brain, an extreme example is a stroke, right? So an ischemic stroke is a lack of blood flow to an area of the brain. And so blood flow is pretty vital to the function of every tissue within the body. So then the question is, how does the brain regulate blood flow? So there's really three main ways that the brain regulates blood flow. The first is what is called autoregulation. And so the vessels in the brain work a little bit different than the blood vessels in the body. And what I mean by that is that the autoregulatory system in the brain kind of relies on your ability to maintain blood pressure from the neck down for that to work as well. So that if blood pressure drops in my body, right? So in my neck, in my trunk, wherever it may be, blood vessels in my brain will actually dilate to try to get as much blood up to it. And if blood pressure is really high in the body, it'll actually do the opposite. It will constrict to protect the brain from too much pressure, right? This is this autoregulatory system. And this autoregulatory system really shouldn't have to work too much. It should rely on a part of your body called your baroreceptor to maintain pressure. And we'll talk about how that fails after an injury, but ultimately autoregulation shouldn't have to work too much, okay? And then we have two other things. We have another thing called vasoreactivity. Vasoreactivity is the ability for blood vessels to react to carbon dioxide and oxygen. So as oxygen goes up, blood vessels tend to constrict. As CO2 goes up, to keep it simple, blood vessels tend to dilate. And this makes sense because as we feed into the third, which is what's called neurovascular coupling, which is how well I can get and connect blood vessels to a part of my brain if I want to move my left hand, right? So as I move my left hand, there's got to be neurovascular coupling, meaning that there's got to be blood that goes to that representation of my brain. And then what happens is as I move my hand more, I increase metabolism in that region of my brain, which should increase byproducts. It should change the acidity of the tissue. It will increase CO2, which will in turn cause more dilation and more blood flow to go there, right? Because ultimately we only have so much blood in the body. We don't just make more blood because we want to move our left hand. We're kind of stuck with the blood that we have. So what we have to do is be very efficient in how we shunt it and move it, right? Do we need to move it here? Do we need to move it to our arm, to our leg? And so those are really the three main ways that our brain regulates blood flow. And ultimately, head injury can alter that, which we'll talk about later. It can alter all three of those mechanisms or one of those mechanisms. And it can also affect that baroreceptor system to where people lose the ability to maintain blood pressure in their body, which then causes these systems in the brain to try to work even harder.
Mm-hmm. Yeah. And I mean, I don't know if this is a rabbit hole we want to go down or not, but I'm just thinking too about after brain injury, you're typically stuck in your sympathetic, you're stuck in fight or flight. And when you're in fight or flight, your body's natural reaction is to like send the blood to your limbs so that you can run away from, the lion that's chasing you, right? So, like, how does that play into it as well?
Yeah, so I think that is a good question and a rabbit hole. And I think what I'm going to challenge people to think about is the autonomic nervous system in a little different light, in that people are aware that we have a sympathetic arm or a fight or flight and a parasympathetic rest or digest. And really when we look at that, they are both working very much in unison at all times. And what really happens, or I guess a different way to think about it, is that when we think of our ability to regulate, let's say, blood pressure and heart rate in the body, we have these hierarchies or levels of reflexes. So we have these reflexes that sit in the lower part of our brain, the primitive part of our brain, that have simply to do with understanding low pressure, high pressure. Do I need more blood pressure? Do I need less blood pressure? Oversimplified, but to keep the example, that's ultimately kind of what the reflex does. But like everything in the brain, there's something that controls it, and there's something that controls that, and it goes up and up and up until we get to this executive brain. And so we actually do know that limbic areas, or areas that have to do with autonomic arousal, and especially fear responses, are integrated into the autonomic nervous system. So you really did say it perfectly, in that the systems that have to do with reorienting us to a lion, to a robber, to whatever it may be, are very integrated into these reflexes within the brainstem. And so what can kind of happen is that, you maybe have someone that has a brain injury, and they affect, let's say, the executive part of their brain. What happens a lot of times is these limbic emotional areas become very unregulated. And so they may get set off for whatever reason. And you see this quite often, right? People get a head injury and they become very anxious. They become very neurotic. They're lit. It's like Pandora's box is just firing at all times, right? You see them, their pupils are blown out, all these different things. And so that alone has such heavy influence into your ability to regulate blood pressure and heart rate and breathing, that those in turn could throw off those basic reflexes, which then could throw off your ability to get blood to your head. And then the less blood you get to your head, the worse those systems work, and it becomes this vicious cycle. So that definitely is a real thing that happens. And we see that all the time with people where, like autonomic arousal. I mean, I had a patient not too long ago, and I've had a few patients like this, and not to get too inappropriate, but this is where sometimes you see people where any sort of arousal can hurt them, right? Whether it be something fearful or whether it be something even sexual, or, what you might seem as pleasurable, anything that stimulates those arousal centers can totally mess with blood flow throughout the body because they're hardwired together. Because it makes sense that if you got to get away, you got to move blood to the appropriate part. The problem is when it becomes a little screwy, that activates and it doesn't do what it quite should do. And it just starts moving blood in places that don't really need them.
Yeah, I mean, that totally makes sense. I mean, blood flow is blood flow, right?
Mm-hmm.
No matter where it's in your body, it's flowing. So maybe let's switch to like what happens after a brain injury. Like, what are the consequences of when you're not getting blood flow properly to your brain?
Yeah, so the consequences of not getting blood flow to your brain after a head injury are not great, right? I mean, but this is where it can look just like any other patient, right? They can be dizzy, they can be lightheaded, they can have brain fog, they can be really anything, right? Because I've heard it described really well of like, think of like your worst hangover. And a lot of times when people have altered blood flow to their brain, it's like they're just living in the worst hangover, right?
Yeah.
You're anxious, you're shaky.
That's how I used to explain it.
But you're kind of wired, but you're dizzy, you have a headache, and really because the reason why it could be just numerous symptoms is that it comes down to where are you losing the blood flow, right? If you're losing blood flow to maybe the representation of your arm, maybe your arm's going to be doing funky stuff. Or if you're losing blood flow to visual centers, maybe you're going to have visual symptoms and so on and so forth. So really, most of any symptom can be blood flow related. What the research does show, which is pretty common, is like the post-concussive headache, like the post-concussive headache that just doesn't go away, that lasts for months and years. There's more and more compelling research that may be due to altered cerebral blood flow. So altered autoregulation and altered vasoreactivity, right? Which makes sense, right? People do all of these different things in therapies and nothing really helps with the headache. And ultimately it's because it's a blood flow issue. And like you said, it's overlooked like a ton,
Yeah.
and I've even been guilty in the past years too. And the more you learn, the more you start to realize in a lot of post-concussive cases, there's usually some alteration in blood flow. And if you think about it, if you're trying to rehab someone's brain and they can't move blood efficiently, how well is that rehab going to go? Or how quick are they really going to get better? Versus if you can really normalize the blood flow, then you have a strong basis to rehab a part of your brain, right? So then it's getting nutrients.
Yeah. And what are some ways that it manifests? Like, what are some of the symptoms that people with a brain injury might be dealing with and have no idea it's connected to blood flow, right?
Mm-hmm.
And like they're going to doctor after doctor, and like I said
Mm-hmm.
earlier, like traditional doctors don't know what it is or even look for it, right? So what are some of the ways it'll manifest? Like obviously like a POTS, right? But what are some of the big clues that you might have blood flow issues going on?
Yeah. So I think, like you said, I mean, there's the pretty common, what people think of, being lightheaded with standing, feeling faint with standing, feeling like they're going to pass out or like they can't catch their breath, heart's racing, right? Those are pretty common things that a lot of people are aware of. Not so common ones, I would say, are, like I said, post-concussive headaches that like nothing is changing, but that are worse a lot of times with exertion. So a lot of times individuals who have blood flow issues, honestly, you see it go one of two ways. These individuals sometimes do exercise and it brings them to life, like it makes them feel amazing. And then the counter to that is individuals who have exercise intolerance. Exercise intolerance, yes, can be a visual issue or a vestibular issue, but if a person is just on a stationary bike and it just destroys them, to me, that's a big clue that there is a blood flow issue. So exercise intolerance, and then post-concussive headaches, or any symptom that gets better or worse with exercise can be a clue. And then one of the biggest ones I'd say is endurance. So individuals with blood flow issues have very little endurance, or their ability to do multiple things is severely affected, or the more they do, the more they fatigue. So you're thinking, if there's an endurance issue, why are they not getting fuel to perform a task, right? Or they do something, and the more they do it, the worse they get. I'd say those are probably the most common is brain fatigue, mental fatigue, and inability to do multiple tasks, and then symptoms that may improve or get worse with exertional therapy. A lot of times is a huge, huge sign. And those are things besides some of the common ones like we talked about, like, I feel way better when I'm lying down. If I'm lying down or I'm sitting on a couch, I'm okay. But if I'm upright, I just feel terrible. I got terrible brain fog. So that's another thing where you're looking at it. Yes, that can also be sensory processing, inner ear and vision and things like that, but it also can be vascular. When you're lying down, you don't really need to work that hard to get blood to your head. Upright is a very challenging event for our autonomic nervous system. And when that fails, most individuals don't do well standing. So then if you don't do well standing, how well are you going to do running or anything exertional beyond that? So I think those are some pretty common things to start being concerned and chatting with your doctors. Like, hey, could there be a dysautonomia or some sort of blood flow component behind my head injury?
And so what are some of the ways like you can test for it to know that this is the problem?
Yep. Great question. So there's a few. I'll kind of chat about some things that we do. And then there are a few other tools out there that we don't use, but some individuals kind of in our, circle of professionals use that are really cool. So one of the ways is just kind of various autonomic testing. So this is where we will do things where we will look at blood pressure, heart rate, oxygen, and we will monitor that through different scenarios. So one of the first tests that we do is what's called a deep breathing test. And what a deep breathing test does is a person breathes in for a count of 5, out for a count of 5. And what we're doing is we're measuring how the heart rate fluctuates and then how blood pressure fluctuates with it. And this looks at what is called cardiovagal function. So in essence, our heart intrinsically, without influence from the brain, would go pretty fast, right? 100 plus beats per minute, right? The reason that our heart at rest is going, 50 to 80 or 90 is largely from influence from my brain. The brain comes and puts the brake a little bit on the heart to keep it from going too fast, okay? And so that is what's called cardiovagal function. Ultimately, how well can the brain, the lungs, and the heart integrate together to speed up, slow down heart rate? That's one of the first tests. The next test is what's called a Valsalva test, where what we do is we have an individual blow into a tube. This induces low blood pressure. And what I want to see is that if I induce low blood pressure mechanically, how well can those sensors travel up nerves to my brain and then cause my blood vessels to constrict to then pop back up blood pressure, right? So it's looking at my reflex, what's called my baroreceptor reflex that can detect high and low blood pressure. So we look at that test. And then some of the last few, the next one is what's called a tilt table test. This is where we tilt people up. And now I'm using gravity to just pool blood into someone's feet. And I'm seeing what does their blood pressure do? What does their heart rate do? And what does respiration do? Because all these things are very interlinked together. As in that if blood pressure starts to plummet, I'm going to change my breathing to alter oxygen and CO2 to try to compensate for that low blood pressure or poor perfusion in my brain. So breathing, blood pressure, and heart rate are all intermingled. So we get a picture of what's going on there. And that gives us kind of a window, honestly, in everything from the neck and below, of saying how well are they maintaining blood flow in their body? Because if that fails, we can usually guarantee it's happening in the brain. When it looks at truly identifying blood flow to your noggin, there are some ways we do it, which I will chat about, but one of the coolest ways is what's using a transcranial Doppler, which is like an ultrasound, but on the vasculature of the brain. And this, in essence, is, once again, we don't use, I'm hoping at some point to have it, but some other colleagues of ours do use it. Dr. Kaiser being one of them, where all these things are really cool. And if you see all these fluctuations in the body, but that can show you how the blood flow is actually changing in the brain as well, right? And this comes in really handy in cases where all that testing looks normal and you're like, but they're still getting lightheaded, but they're maintaining all these things, but you may see that you go to stand and then blood flow velocity to the brain starts to decline. And then you can see in what artery in the brain that's happening, right? That's really like the creme de la creme. Like that's the one of the coolest ways to tell. And there's ways to do it without technology where we can measure pulses. A lot of times we'll look at changes in vision or changes in symptoms at different tilts that can kind of give us a window into like, oh, that got really bad. That most likely is because there was a lack of blood flow. So there's some indirect ways as well, but those are kind of the main ways that we can assess and say, how well is your brain regulating blood pressure, heart rate? And that gives us a pretty good idea if you're maintaining blood pressure. Because if, let's say you go from lying to standing, and your blood pressure goes from 100 to 80, most likely your brain is not doing well, so we don't necessarily need a Doppler to tell us that you're not getting blood to your head if your blood pressure plummets, 20 points.
Right.
So there's a lot you can tell with those different tests. And sometimes we'll compare tests lying versus standing. You'll find things get markedly better lying down. And you're starting to wonder, okay, if I lie them down and I saturate their noggin with blood, or I put them in the hyperbaric and I bring them out and they're a new person, you start wondering what's going on of like, why do they do well here, but they fail when they're upright? So it's kind of this whole clinical picture that lets us know like, hey, there's a blood flow component.
Yeah. So Dr. Kaiser had Dr. Cassie, who's local to me. He gave her some tests to do on me. And I had to I did the laying to standing and laying to standing.
Yeah.
I did it a few times. And then, oh, they're going to snowplow now. Perfect timing. I hope you don't hear that. And so when I laid down, she had me lay for 5 minutes or something.
Mm-hmm.
And my vision got worse.
Mm-hmm.
And it's interesting because I've noticed it before, but I wear contacts. So I was always like, oh, my contact must have just kind of got dry and moved and stuck to my eyeball. So that was really interesting. And then when I stood, then she had me stand, and then within a few, maybe not even a minute, my vision cleared up again. And I was like, whoa.
And that's where you can eat. I think that's a good point you make, is we talk about it as always the opposite, that people do better when they're lying, but
I'm the outlier.
It can go the other way to where, what you can see is that when someone lies and then maybe blood backs up or moves into the head, that there might be an increase in intracranial pressure or an inability to regulate blood flow. So I think that is an important piece, is it's not always standing and not getting blood to your head, versus these systems are deciding how much to let in and how much to let out. And sometimes they can let too much in, and that can increase pressure, which can then press on the optic nerve or all sorts of different things. So I think that is a good point, that you can also have that as well. Yeah.
Yeah. And I know I've always perplexed every doctor, when I go from standing to lying, and then my heart rate goes up when I lay down, and it should go down when you lay down. So I've always perplexed people with that. They're like, that's weird. And this was even before my brainage. I remember.
Yeah.
So, interesting. So Perry, there's clearly hope for people struggling with any of this. What are some ways that you can help resolve some of these issues?
Yeah. So, I mean, one of the first things is identifying. So if someone does have altered blood flow, is identifying maybe the reasons behind it. So when you look at a head injury, there can be a variety of different ways that it can throw off these reflexes. And so we'll go through a few of them to keep it simple. But one of the first things is, like we talked about, so within that brainstem center is where these reflexes happen. Sometimes those reflexes themselves can be injured, but other times it can be the input that is presynaptic or fires into that. So what I mean by that is, if we think about it, if I don't have good sensory, and this is common in head injuries, if I don't have good sensory processing of my body or my head or my vision, those things are hardwired to my autonomics that we mentioned before, right? If I'm running from a line, I need to know where it is, I need to hear it, I need to see it. So what's very common after head injuries is that there's alterations in sensation of body. So they may not feel the whole left side of their body, right? That's not going to help you regulate your autonomics very well. They may have alterations in their central vestibular system. That heavily influences autonomics, because if you think about it, when you go from lying to standing on a tilt table, the fastest thing to tell you you've changed position is your inner ear. So we know that your inner ear is literally hardwired with blood pressure responses. And then, like we talked about, everything top up. So arousal, limbic areas, cognitive areas. So a lot of times the key is finding which one of those autonomic loops seems to be broken, and then how are external things influencing. Because you may have someone where, by improving awareness of the left side of their body, they now stand and they can get blood flow. Because when they stand, if they don't know where their left side is, how the heck are they supposed to regulate blood flow? Or maybe theirs is a vestibular thing, so they don't really understand forward and backwards motion. So every time they stand, the signal the vestibular system is feeding the autonomic system is not correct. So that's where it can be dependent. And sometimes it comes back to like fixing all the broken sensory processing systems. But there are sometimes where we also need to retrain those reflexes. So this is where we may use a tilt table where we're going up, we're finding the point at where these systems fail, and then we're coming back down. And then we're trying to kind of prime the system, go back up, come down, go back up, come down. And ultimately, we're trying to get and do some retraining to get someone to be able to go from lying to standing. Eventually, once you can get that, then that's where we can move into more exertional therapies, exercise, to try to rebuild that autonomic system even more. So the cool thing is there's all sorts of therapies that can be effective. It just depends on what that person needs. It's even like a POTS patient, right? Not all POTS patients are the same. One POTS patient could have really low blood pressure. One could have normal blood pressure. One could have high blood pressure. And the way you would look at those clinically are very different. So, it's really important that you work with someone that can effectively assess these things, work them up, and then understand how they all integrate together to then be able to create a plan to then improve those reflexes and ultimately, hopefully, speed up the recovery versus spending years and years not necessarily getting to the root.
Mm-hmm. Yeah. And I think I see that just all the time in the brain injury world, right? Like they've tried so many different therapies and treatments and just don't get any better. And, I want those people who are in that situation to know that there's still hope, right? There are providers out there like you, Dr. Perry, that know how to look for these things and treat with these things. And, it's so unfortunate that our healthcare system is just set up the way, I mean, it's a whole other conversation, but they don't refer out of their bubble. And if they could only get people to you so much sooner, right? Like people wouldn't have to struggle for as long as they do.
Yeah, no, you're totally right. I think that is the key, is there is definitely hope. And unfortunately, you would think that cardiologists would be very attuned to a lot of these things, but they are not at all. But there's people, there's a lot of people around the country who are aware of these things. And I think if you're asking about these things and someone doesn't know anything about them, then maybe you should be asking yourself the question, is this the right place for me? Not that everything is blood flow, but if you're managing head injuries and you're not addressing or understanding that is a possibility, then I think a big puzzle piece is being missed.
Mm-hmm. Yeah. And so, Dr. Perry, if anyone listening wants to learn more, has questions, they can reach out to you via your website is integratedbraincenters.com.
Yep.
And they can always schedule a free consultation with you, correct?
Yep, they definitely can. Yeah, and that allows us to kind of review your case, but also sometimes it might be able to, I was chatting with someone sent me a message, and they were in a certain place in Tennessee. And I was like, oh, I know someone like in your back door. So sometimes it's helpful to also help guide people to find a practitioner close to them, or to be able to try to manage their case from afar. Or sometimes a lot of times we have individuals who will fly out for care with us, and we'll do kind of intensive type things where we'll work with someone for 1 to 2 weeks. And during that time, we're really trying to kind of re-normalize those systems that seem to be broken, to create kind of a plan for people to continue at home so they can keep getting better.
Yeah. Awesome. Well, thank you so much for being here. I think this is a really great topic. I think it's the missing link for a lot of people. And so I hope that hearing today's TBI talk, I hope that it might help some people find some clarity and get the right providers for some help. So thank you so much for being here today, Dr. Perry.
Thanks, Amy.